When it comes to disparities in maternal mortality, our country nationally, the United States, is doing really poorly compared to other developed countries. So the work we do is very key in addressing the underlying causes and looking at the root causes of those disparities and poor maternal health outcomes. And so that's what our lab does. We work with a huge center. We just received a huge funding from Health Research Services and Administration to address and improve maternal health in the Harris County and Greater Houston area.
One of the ways that we've seen kind of real world engagement and impact is through a collaborative that has been born out of the Community Engagement Corps in a partnership with the Gulf Coast Consortia to develop a community engaged healthcare educational program. So it's really been exciting to provide this educational opportunity where the community is educating our clinicians and our researchers in how to do this better, in how to develop and deploy, make available important life-saving interventions and technologies.
For me, it's all about watching the light bulb turn on, the fire get lit again or rekindled in our participants' eyes. And that's been the huge payoff for me, to see faculty come into being, become more excellent at what they're doing, to see the energy come back again, and it spills out into the students. They're happier people. It was just very rewarding.
CPRIT stands for Cancer Prevention Research Institute of Texas, and within the name itself, it is cancer prevention. So we applied for this funding mechanism under the prevention pillar of CPRIT, which positions us or allows us to be able to offer mammogram at no cost to uninsured and underinsured women. So with that, we are addressing a major barrier for that population. The fact that we're able to provide services that is a bit more convenient, accessible, and specifically at no cost to uninsured, underinsured women is a big, it's a big priority for CPRIT, and we are very grateful to have been able to receive that.
One of the great things that are coming next in the future and that we're working on, because we like to think ahead and work ahead, is that the university has deployed a lot of infrastructure for artificial intelligence when it comes to artificial intelligence, the marriage between artificial intelligence and social determinants of health. So our core facilities here at Texas Southern University, we've deployed a lot of infrastructure, resources, and capacity into studying the role of artificial intelligence in addressing a lot of these disparities within maternal health, and even using artificial intelligence for drug discovery and development. We hope that in the future, with all our work, we hope to see that the synergy of working together with the key stakeholders will really move the needle when it comes to reducing breast cancer health disparities within our community that we serve.
Good morning. Good morning. Happy Saturday, everybody. Thank you so much for being here today at the Healthy Cooking Challenge 2026. I'm so happy you guys are here. Well, before we start, I just want to welcome everybody. Thank you for taking your time for being here on this beautiful Saturday. I know it started kind of foggy, but it's so beautiful outside. I can't wait for everybody today to give out free resources to everybody, all our vendors. Thank you for being here. And also for y'all to try the awesome food and hear from our registered dietitians and doctors that we have here today. Welcome to everybody online. Thank you so much for joining us online. If you like, can you please drop a GIF or an emoji to show your excitement for today's Healthy Cooking Challenge? Even though you won't be able to try the food today, you'll be able to hear about it and also hear which chef is the one that wins this title of the Best Heart Healthy Dish 2026. We will start right at 11:05. I do want to wait a little longer for more individuals to come in. So at 11:05, I'll come back. If you have any questions, my name is Joanna Dominguez with Harris County Public Health. Thank you.
I remember this young lady, she had just gotten vaccinated. She's African American, and she goes home and she talks to her grandmother. Grandma, you need to be vaccinated. Grandma says, absolutely not. I don't trust the healthcare system. I don't trust any of these people. I'm not going to get vaccinated. The young lady says, well, Mom, the lady who vaccinated me is African American. She says, well, in that case, take me, I want to get vaccinated. The message is important, but so is the messenger.
Data and science and study have shown that African American individuals are much less likely to be enrolled into a clinical trial. So the EQB Med initiative is going to address this major and critical problem in our community.
EQB Med initiative positions us at Texas Southern University to actually have access to innovative and breakthrough clinical studies. We do a lot of work to increase awareness about clinical research participation, but without an opportunity to actually open access for individuals to participate and to build trust in clinical trial process, we are very limited.
Pharmacy is a very important team in communication with the community. And we are not only have our PharmD program, we also have a PhD program. With that, we have more outreach to the community.
We are the #1 producers of African American pharmacists in the state of Texas. Pharmacists are a significant part of the healthcare team. They're able to immunize patients. They're able to help them in a variety of health settings per se.
TSU had the RCMI support back in 1980s, especially in terms of research infrastructure. So the students and scientists can conduct most cutting edge of research, especially in the area of drug discovery and development.
In 2024, the College of Pharmacy and Health Sciences celebrated its existence of over 70 years. We lead a lot of initiatives advancing health equity, training community health workers, providing continuing education for community health workers, as well as for our pharmacy and health administration students.
In this initiative, we are going to partner with UTMB, Yale University, and Morehouse School of Medicine. We will be able to gain more experience and resources and guidance on how to recruit for clinical trial and how to conduct clinical trials.
So this clinical research initiative under the EQB Med funding mechanism allows us not just to provide opportunities for clinical trial participation for community members, but it creates a platform for us to train the next generation of pharmacists that will be culturally competent, that will have an high level of awareness of engaging with community members to promote the concept of diversity and equal representation in clinical research participation.
Okay, buenos días. Tenemos intérpretes que hablan español. Por favor, levanten su mano o pónganse en contacto con Ana Molina o Lourdes Araiza. Por favor, levanten sus manos para nuestros intérpretes. Ahí están. Si necesitan ayuda, por favor, contáctense con ellas. Ellas les pueden ayudar para que entiendan lo que está pasando, porque vamos a estar hablando en inglés. Muchas gracias. Okay, well, like I had said, my name is Joanna Dominguez with Harris County Public Health. This is our 3rd year hosting this Healthy Cooking Challenge. Today we have amazing vendors here for you guys to go and talk to. And we also have chefs ready to make some food for you. But before we get that started, I did want to introduce the amazing people that has helped me to make this event possible. And yeah, let's get started. I want to first start off by introducing my team from Health Promotion, which is Kari Hateable, Ariana Kosovan, and Michelle Cajero. Thank you all so much for all your help. We also have Arian Raxter. She's our engagement specialist. Abha Dihikari. She is conducting a survey later, so please fill it out. And Mariana Rendon. Where is she? She is our registered dietitian who will be educating later to you guys. To continue, today we have doctors from McGovern Medical School at UT Health Houston. With us we have Dr. Taylor Hopper. There she is. She's wearing an orange shirt. Thank you for being here. And also Dr. Stephanie Badge. Both of them are internal medicine resident physicians, and they're ready today also. They have an awesome presentation for you guys. Next, I know you guys are here for the main individuals to try their food. We have our awesome chefs. So the first one I wanted to introduce is Chef Adrian Clayton, representing HISD Barbara Jordan Career Center. She's the one over there in all red. And her sous chef. Her sous chef is Chef Chloe Walker. I would like for y'all chefs to please come over here. Come over here. Come say hi to the camera as well. So there you go. There's Chef Clayton. The camera's right there. Okay. Next, we have Chef Marcus Flakes with Pantry App. And his sous chef, Dolores Allen Flakes. Beautiful couple. Okay. Next, we have Chef Juju from Cafe Juju. And her sous chef, Chef Robin McNeil. Last but not least, making his return is Chef Daniel Pinset with Pinset Soul. And his sous chef Jose Chavez. So this is the lineup that we have here for 2026. They're gonna be preparing some heart-healthy dishes for everybody to try today, especially those that have a wristband. So raise your hand if you have a red wristband. Woohoo, come on over, come sit down. You guys later today will be able to judge, taste their dishes. Thank y'all for being here, chefs. Okay, moving on. Okay. For TSU, I want to say a huge thank you to Monique Gongora, Dr. Jones, and Saneha George, and also a special thank you to Dr. Veronica Jawali Mawama. She is the professor of pharmacy practice and director of the TSU Center of Biomedical and Health Research Community Engagement Corps. They are recording this event to the individuals online. The recording will be available on all of their YouTube platforms. So if you have any questions on how to find their YouTube, we have them right here. Dr. Jones, please raise your hand. You can come and ask her so you can find this recording later. Moving on to Harris Health. We also have Harris Health in the building. They're representing. We have Kyle Maroney. He's the Community Health and Wellness Manager. And Lazana Barrett over there. Woo! They both work at Harris Health, Sheila Jackson Lee Center for Accelerating Health Outcomes. Next, I do want to say a huge thank you to the individuals, the programs, organizations that help us distribute this flyer. I want to start with Northeast Houston Redevelopment Council, President Huey Wilson, and Vice President Ken Williams, representing Trinity Gardens, Super Neighborhood 48. Woo! Thank you. And next, President Keith Downey, representing Cashmere Gardens, Super Neighborhood 52. Thank you all for helping us distribute this flyer. Also, whenever you get a chance, visit Harris County Public Health on Instagram and Facebook so you can see me doing my acting debut. we did an amazing short for Instagram where we were presenting the Healthy Cooking Challenge, and it's funny. Go ahead and go look at it. And also, thank you to HISD, a special thank you so much for opening up the doors for us to come and have this Healthy Cooking Challenge, this free event, making it possible for community to learn about what they're going to learn today, which is cardiovascular disease and how to live a healthy, heart-healthy lifestyle. And those with HISD, thank you, Mr. McAlpine, Mr. Ford, Miss Chris Robertson, Miss Stacy Hammond, Miss Yvette Mason Ferguson, and a special thank you to Dr. Donna Kermush for donating the space and the security. Thank you so much. And the security is over there. Thank you, security, for keeping us safe today. And last but not least, the vendors. Thank y'all so much for being here. Please, everybody, go and talk to them. They have amazing resources. They have free resources for you to take home, a lot of great education, a lot of education that you can learn and also teach your family. And so your children can also learn about the free resources and educations that are here. One special note before we get started. If you see your table, there is a QR code for the Area Agency on Aging. They're conducting a survey for older adults here in Harris County. They will love your insight. So anything that anything that you want to let them know on how they can better services for older adults here in Harris County, please use that QR code. We will be conducting a lot of different surveys from Harris County Public Health, Harris Health, and TSU. I urge everybody in the community, please fill them out for us. If you fill out these surveys, they help us to bring awesome free events like this to you guys, for everybody in the community. Okay. So now, you might be asking yourself, okay, Joanna, you said thank you to all these individuals. Yes, because they have been helping us a lot. But now I wanted to talk to you about the purpose of the event. The purpose of the Healthy Cooking Challenge. Like I said, this is our third year hosting the Healthy Cooking Challenge, which is hosted every February. We hosted in February to align with Heart Health Month and raise awareness about cardiovascular disease, or CVD. CVD refers to heart disease, heart attacks, strokes, or heart failures. And today you'll be able to learn about all of those different cardiovascular diseases from our doctors. Unfortunately, CVD continues to impact families and communities here in Harris County, and we have found that it's very important to continue to educate and bring awareness about these diseases. And the way that we're doing it is by education and also having chefs prepare heart-healthy dishes. They're going to be delicious for you guys to try, and then hopefully incorporate them in your lifestyle, in your kitchens, and also show them to your families. Maybe you might have a recipe that has been passed down from generation to generations, and there's a little tweak that maybe you can do to make it a little heart healthier. You will be able to learn that here today by learning from the doctors, also the chefs, and our registered dietitians. Now, you might be asking, what are we going to do? We have these wristbands. Well, yes, today you're going to be able to vote for the best heart health dish of 2026. Each chef will prepare a small plate, a very small plate. Let me put this down so I can guys show you. It's going to be this small. It's about 4 to 5 ounces of food that you'll be able to try. It's going to be 4 different dishes that are going to be plated right next to you. And you are going to be our judges. Everybody that has a wristband, you're going to judge for the best heart healthy dish of 2026. Whichever chef gets the most votes, they'll be the one that win today's challenge. Isn't that exciting? Yes. So let's see if I'm right on time with everything. Okay. Perfect. So I hope you guys are ready for a fun day of education. I did want to pass over this mic over to Michelle Cajero. And one last thing I forgot to mention. Now, the chefs do not know what ingredients we have for them. These ingredients have been selected by myself and the rest of the health promotion program and registered dietitians. All of the ingredients that we have selected are the ones that you might know, but we are making sure that maybe if we grab ingredient A, it's lower in sodium, right? So that's the way that we decided to change it a little bit. And right now, Michelle is going to show the ingredients that we have to you guys, and it's going to be the first time the chef's seeing the ingredients that we have as well. So, Michelle.
Great. Thank you so much, Joanna. Everyone give a round of applause to Joanna for being a wonderful host today. Again, my name is Michelle Cajero, and I'm a health promotion coordinator also in Harris County Public Health.
Hello.
Hello.